I'm Senator Jeff Smith, and today I'm going to speak to three very important persons in today's world, in our area. Three public health officials from three different counties: Buffalo County and Trempealeau County and Eau Claire County. And we're going to start with April. You want to introduce yourself? Tell us what county you're from and what's happening in Buffalo County.
Yeah, I'm April Loeffler. I'm the health officer for Buffalo County. We're a small county, and so we have a little bit smaller numbers. We're rural. Right now, we have a total of 8 cases of COVID-19. The tool we're using for helping people guide recommendations and how they can practice safer practices, the Hooley COVID Compass. I can share that link. And that is, it is based on what the disease is doing, the healthcare capacity in the region, as well as the public health capacity's ability to respond quickly and help contain the spread of the disease. And those categories will give recommendations for when we're in low risk, medium risk, medium or moderate risk, high risk, and severe risk.
So Barb, in Trempealeau County, can you introduce yourself and tell us the highlights or lowlights of what's happening in Trempealeau County right now?
My name is Barczak, and I'm the Director Health Officer for the Trempealeau County Health Department. Trempealeau County is a rural county. We have a little over 29,000 residents. At this point in time, we are at 124 positive COVID cases in our county. We started out a little bit slow, which was wonderful, but that has picked up here tremendously. We, like April, participate in the Compass, which La Crosse County coordinates for us. We are currently at a high risk here in Trempealeau County. And as April said, the Compass takes into account a variety of risks, and that's what health departments do, is we do our best to manage risk, either issuing guidance that will either lower your risk of contacting the disease or increase your risk of contacting the disease. And I believe that most people are doing their best to lower the risk. I wish I could say everybody does that, but that would not be a correct statement. And basically, the big message that I keep getting is, if you protect yourself with masks, with social distancing, with not attending large gatherings, you're not only protecting yourself, but you're protecting your family and you're protecting your community.
For sure. All right. And Lieske, you want to catch us up on Eau Claire County?
Yeah, I'm Lieske Giese. I'm the health officer from Eau Claire City County Health Department. We cover the entire jurisdiction that is both the city of Eau Claire as well as all of the rest of Eau Claire County. We obviously have the largest population size in the group that's sharing with you today. And we've had a lot of cases. We're over 250 cases now. And we've, in the last 2 weeks, seen a 238% increase in the number of cases that we've been seeing. So a rapid increase. The state rates every county for what is happening with COVID-19 in the county, what the current, that trajectory of disease. And Eau Claire County is at that high level. So really the concerning place of, we are rapidly increasing with cases, not having a slow increase like all of us are working toward. And we're concerned. As both April and Barb shared, there are some really clear and specific strategies that can help us slow things down. We know this is a disease that none of us have immunity to. So our goal is not prevention of the disease entirely. Our goal is really to slow it down as much as possible. And the use of really some specific and clear strategies is what all of us are pushing. So keep that 6-foot distance, wear a cloth face covering when you're out, stay home when you're sick, are very basic messages that I think many of us can gloss over, but with community spread happening in really all of our areas now, it's real, and we need to work together to protect each other.
It seemed like the spread had kind of leveled off for a bit, and now in the last couple of weeks, we've seen almost a surge. Do any of you have a theory or explanation of why that has happened?
One of the things, I'll just speak from a big picture perspective, but each of us has slightly different environments of where disease is spreading. The truth is, with Safer at Home, the state order that started in the spring, we had very little disease in this part of the state at that point in time, just from the way disease spreads. It spreads geographically, and it started in the southeast corner, and it had not yet gotten to this part of the state, either via Minnesota or southeast Wisconsin, when the Safer at Home happened. So the minute we opened up more, I think all of us anticipated that we would start seeing disease. And we are now not at a surprising point that this is something, again, that none of us have immunity to. And the more we interact with people and don't maintain distance, the more it will spread. Our goal and our job is to stop spread to those populations where people will get severely ill or die.
In Trempealeau County, we started seeing our numbers climb after the Memorial Day holiday. And in all honesty, I'm expecting another surge after this holiday. It's in our human nature. We're social animals. We like to be, with friends, and holidays tend to make us more social. But I would ask everybody to please keep in mind that, while we are being social, while we are celebrating the holiday, either for Memorial Day or the 4th of July, we are putting both ourselves and our families and our community at risk if we don't take steps to protect ourselves.
And April, can you give us a rundown of why people should wear a mask and how it works?
The simple way I like to describe it to people is we always tell people to cover their cough, to help control the spread of any illness when we're sneezing, coughing, those types of things. And so it's really helping prevent you from putting larger droplets into the air.
Yeah. And so a mask isn't, I know that people have heard this 100 times, but it seems like it hasn't gotten through to everybody that a mask is not, you're not wearing it to prevent yourself from contracting the disease. You're wearing it because you may carry the disease and you may pass it on to someone else. Is that correct?
It works mainly to protect others from us, but by us having a mask on, there is some protection that it gives us if we are in contact with someone else. And the best scenario would be both people wearing masks to slow down the spread of those droplets through the air.
Yeah, I think, the best thing is distance and masks. There are certain circumstances where where distance may be a bit challenging. And then certainly both me and the people I'm interacting with wearing a mask. It's about, as you said, Jeff, it's about caring for those people that we love in our communities. And I think we have in Western Wisconsin people that really care about one another. And it's really showing caring in a different way. We've not had to do this before, so it's a bit weird and a bit uncomfortable. But I think the more we can talk to each other about, this is about me caring for you. This is about me wanting to make sure that our businesses stay open, that our schools can open in the fall, that we can do the things that are so critically important to us. The more we wear masks, the more our disease will slow. And we should be motivated to do that because all of us do want a bit more normal. And if we have rapid spread of disease, more things are going to close and more things are going to be challenged because they won't have the workers to work at them. The teachers won't be there. I mean, I think we have to understand that there are consequences, and this is it's a hard thing. I don't love wearing a mask. It's weird, but being able to do that is a simple way to show others that we care about them.
Yeah. I'm reading a book on World War II right now, and specifically England, and the sacrifices that people were asked, in fact, ordered to do then were incredible, and they did it. And all we're asking now seems so harmless and simple by comparison. And I just want to find any way possible that we can help people understand that it's a simple sacrifice to wear a mask, stay distance, and stay home if you can, and not get into the large gatherings. So one more thing, I think by county is, what are the current numbers? Say, for instance, I know Lieske, Eau Claire definitely has a number of social gathering suggestions for businesses and for gatherings, and April and Barb, you probably do in your counties as well. What would that be in each county?
Our guidance right now in Trempealeau, I believe, is for 50 people for outdoor gatherings. And I think it's still 15 for indoor gatherings.
Our current order requires in any public space for people or family group sizes to be 6 feet apart. So that's the first and most important measure that we have. So whatever the group gathering size is, people are required to be 6 feet apart in a public space. In addition, for those settings where there's a large group gathering desired, wedding, concert, those types of things, we right now are not allowing events that are bigger than 250 people outside and 100 people inside. But even in those settings, an outside wedding of 250 people still has to maintain 6 feet distance. So again, there may be challenges to do that and maintain those orders.
Ours are a little bit different in Buffalo County because they are recommendations, and we use that Cooley compass to guide those recommendations, and it's updated weekly on Wednesdays. So Barb's recommendations were based off of the high risk category. Our recommendations right now are off of the severe risk category. So currently it's recommending no indoor gatherings other than with your household, and keeping those gatherings outside small to 10 and still doing social distancing and wearing your mask. If you want more information, you can visit the Buffalo County website. It's buffalocounty.com. And if you click on the link for COVID updates, you can see the full Cooley COVID Compass recommendations as well.
And I'll just share that additionally, all of us would say, keep your group very small. Regardless of what the recommendations or requirements are, the best practice is to stay with your household group. That's really what we're recommending, all of us are. The Eau Claire website to get more information, including all of our data and resources. It's updated every day, and we update our metrics, our measures that we're tracking once a week on Wednesdays. That's COVID19eauclaire.org. We also have a Monday through Friday hotline on this topic, and that really is a place for people to get more information. That call center number is 715-831-7425.
I add Trempealeau counties here. We have our guidance on our website and connected to our Facebook page. A lot of it is based on WEDC guidance, kind of adapted for our particular situation here in Trempealeau County. We also have a line with the latest information. That would be 715-538-2311, extension 330. And Jeff, I want to thank you for allowing us this opportunity to reach out to our community. Thank you.
I lost my internet connection, and now I'm using my phone to say goodbye, I guess, and thank you all for joining me today. I really appreciate it. This would be very helpful.